Hello, everyone. My name is Harold Phillips, and I serve as the Director for the White House Office of National AIDS Policy. I'm sorry we all can't be together for this meeting, but I am very excited that I've been given the opportunity to speak with you a little bit as we kick off this conference. Where she leads, we will follow her, Women's Summit on HIV and Health. I think you all know that disparities persist among women and that Black women are disproportionately affected compared to women of other races and ethnicities. Although annual HIV infections have remained stable among Black women from 2015 to 2019, the rate of new HIV infections among Black women was 13 times that of white women and 4 times that of Latino women. As you go through this virtual summit, you will hear a lot about both HIV prevention, care, and treatment for Black women. You'll also hear more data and stats, just like the ones I gave you. But that's not what I want to talk to you about as part of my keynote. What I want to talk to you about is the resilience and the abundance of opportunities to change the future for Black women. Black women have continued to be resilient throughout history in this country and across the world. Their work as the pillars for our families and our communities puts them in a position where we can achieve better health outcomes for Black women. Some of this has to start with comprehensive sexual education. The recent NASEM report talks about opportunities that we should all be taking advantage of to embed comprehensive sexual health throughout our lifespans, and that we should teach it not only in schools, but also in our homes. A perfect opportunity when we're thinking about the future of health for Black women. You're going to hear a lot about PrEP. And I've been an advocate for embedding PrEP in reproductive health clinics, and as the OPA, the Office of Population Affairs, begins to rethink and reimagine Title X clinic services, we've also asked them to consider how to better integrate HIV testing and link it to both care and prevention. So we'll hopefully see more of that. Several years ago, not that far along, it was just before the pandemic. It was one of our recent PACHA presentations. We heard from a panel of female researchers of color who talked about missed opportunities for in STI settings, where women who showed up were tested positive for STIs, such as chlamydia, gonorrhea, and syphilis, were not offered HIV testing. And then within a very short span of time, they did seroconvert. We have to capitalize on those opportunities as well. And the fact that this is particularly something that happens in the Southern United States. So again, thinking about our opportunities and where can we capitalize on them. Over this past year, we've seen a great increase in the usage and the availability of HIV self-testing. Self-testing provides an opportunity for Black women to test at their own convenience and then be linked to care and treatment services. We also know that when it comes to Black women and their linkage to care, especially that they do not achieve and maintain viral suppression at the same rates as other women. Some of our most recent data shows that Black women and their viral suppression rates within the Ryan White program are lower than others. I think the number may be 59.3%. We have a goal of increasing that to 95%. But to do that, we have to look at what are the situations that get in the way of Black women putting themselves and their health first. Often it is some of the obligations of family. Sometimes it is the issues of unstable housing, food insecurity, and income insecurity as well. So really looking at the social determinants of health and how do we influence them in positive ways to improve the health of Black women. Also, as we think about a research agenda and we think about the opportunities that are before us, injectables, implantables, combining contraception with HIV prevention for women as well. We need to keep all of this at the forefront and also engage Black women, listen to them, seek their advice and guidance about the best way to begin to make these new tools available so that we do not create new disparities. Again, thinking about the opportunities and the abundance. We can end the HIV epidemic by 2030. I hope you will join me. The president, President Biden, has asked for us to accelerate our efforts. And if we don't use these tools now, then what is it that we're waiting for? What will it take? This is why I'm so optimistic about our time is now. And I hope that as you go through the summit, you will think about what I started with, both the resilience and the abundance of opportunities to improve the HIV outcomes for Black women. Thank you for allowing me to be with you virtually. I hope you all stay well, and I hope to see you very soon. Thank you.